home, our colleagues who are covering this event live, and those at remote centers away from here. As is usual with us, we'll go straight into the presentation. We have our format. We would invite the chairman of PTF to please lead us with his opening remarks. The chairman of PTF, sir, you're welcome.
Your Excellency, the Ambassador of the Republic of Korea to Nigeria, Permanent Secretaries, distinguished members of the Presidential Task Force, gentlemen of the press, good evening. I welcome you to the national briefing by the Presidential Task Force on COVID-19 for today, Thursday, 10th December 2020. As we approach the end of the year, which has been significant by all standards, several competing governance-related activities make it impossible for us to brief you as regularly as we desire. I assure all Nigerians, however, that the work of the PTF never stopped during such moments. We have persisted on deepening risk communication and community engagement, surveillance, testing, and pursuit of a viable strategy for accessing the vaccine in a safe and effective manner. Over the last 3 briefings, the PTF brought the COVID-19 infections and fatality situation in other parts of the world to the attention of Nigerians. We also advocated strongly the need to continue to observe all non-pharmaceutical measures so as to lower the risk of infections. We have observed, rather sadly, that Nigerians, particularly some faith-based organizations, have continued to hold events of large gatherings capable of spreading the virus. The PTF urges all subnational entities that sign the protocols with these organizations and have primary responsibility for enforcing the protocols and the non-pharmaceutical interventions to step up their roles of enforcement. The PTF has also continued to engage with relevant stakeholders on the issues arising from the impact of COVID-19. These include the mental health, drug use, and gender-based violence. This morning, I joined the Christian Association of Nigeria to launch the campaign against gender-based violence, particularly triggered by COVID-19. It is true that family economies have collapsed, jobs lost, mental health issues have arisen, some persons have taken to drugs, and rape has escalated. The solution is to exercise enormous self-restraint, vigilance, and the PTF urges that citizens should take advantage of the mental health programs nearest to them. In Abuja, for example, the Federal Medical Center in Jabi is the facility to visit. The COVID-19 pandemic has persisted in the disruption of human activities. We have just received a report that one of the annual events of a critical security agency has ended abruptly out of abundance of caution due to the detection of an infected personnel. The significance of this occurrence is that testing is critical to the success of our national response. We therefore urge Nigerians and organizers of events to vigorously pursue the path of testing, especially for delegates attending events. The Presidential Task Force recognizes that testing level is still very low in Nigeria. Last week, the country's COVID-19 infections witnessed yet another significant increase after a period of low numbers. The analysis show that the total number of 1,007 new confirmed cases are higher than the numbers recorded in the week of November 29th to December 5th, when a total of 1,102 cases were recorded. For emphasis, the breakdown of testing nationwide in the last 1 week by state is as follows. 4 states, Lagos, the FCT, Rivers, and Ogun, accounted for 64% of all tests conducted. 7 states conducted more than 1,000 tests in the last 1 week. Testing increased in 17 states. Testing also declined in 12 states, namely Sokoto, Kebbi, Niger, Yobe, Borno, Gombe, Bauchi, Plateau, Taraba, Nasarawa, Benue, and Anambra states. Summary of situation pertaining to cases across states in the last 1 week. Cases increased in 23 states. 4 states increased from 0 cases in the previous week, while 12 states had a 100% increase, more than double. And these states include Sokoto, Osun, Edo, Nasarawa, Kwara, Delta, Jigawa, Taraba, the Federal Capital Territory, Rivers, Kano, and Katsina. By implication, the biggest increases by both absolute count and percentage increase, first you have here FCT with 689, representing 129% increase. Kaduna, 365, representing 86% increase. Lagos, with 694, accounting for 77% increase. States that have not reported a case in at least 1 week are Abia, Adamawa, Ebonyi, Cross River, Ondo, Niger, and Yobe. Ladies and gentlemen, global COVID-19 infection cases now stand at 69,215,613, almost 70 million infections. The African regions has crossed 1.5 million, while Nigeria still ranks 5th for the highest cumulative cases and 3rd or 5th in the highest cumulative deaths. The PTF is fully aware of the global race and discussions around the vaccine. The country has set up a technical machinery to ascertain the most effective, safe, and prudent vaccines for Nigerians. One assurance we wish to give is that any vaccine that will be approved for Nigeria will be endorsed by the World Health Organization and must be certified safe for Nigerians to use by our research and scientific bodies. In the meantime, the Presidential Task Force wishes to pass on the following key messages from the World Health Organization. 1, while we work towards rolling out a safe and effective vaccine fairly, we must continue the essential public health actions to suppress transmission and reduce mortality. 2, even as vaccines are rolled out, people will need to keep adhering to public health measures so that everyone is protected. And 3, the pandemic still has a long way to run, and decisions made by leaders and citizens in the coming days will determine the course of the next days and months. And 4, in addition, and in line with the guidance on the use of masks, we need to discourage the practice of removing masks to speak. The Presidential Task Force has observed rather sadly the activities of unscrupulous citizens who do everything to frustrate the transparency infused into the processes of our national response. The first is the report on social media relating to the procurement of fake COVID-19 PCR certificates. I'm pleased to inform you that this is being investigated and technology-backed measures have been taken to limit such activities. We also received the letter, which purportedly emanated from the desk of the chairman of the PTF, Sis Crane. This is outrightly fraudulent, and we urge Nigerians to remain vigilant so that they do not fall into the hands of fraudsters. This letter made an attempt at even forging my signature. In the next 2 weeks, the Presidential Task Force will be submitting its final report to Mr. President. This is not the end of the assignment, as the virus has not gone away yet. Similarly, there is the significant issue of vaccine to address in the coming months and years. In recognition of this, a suitable transition program that will take into consideration the multi-sectoral approach will be recommended. The Presidential Task Force wishes to appeal to all Nigerians to seriously consider putting on hold all non-essential trips and avoid large social gatherings during the Christmas and the New Year festivities. Finally, you would have observed that we have in our midst His Excellency, the Ambassador of the Republic of Korea. His presence is a sign that multilateralism and bilateralism are key to solving the COVID-19 pandemic. In the course of this briefing, he will be presenting a COVID-19 kits to the government and people of Nigeria in support of our national response. I now invite the Honorable Minister of Health, followed by the DG, Nigerian Center for Disease Control, and the National Coordinator to update you from the technical perspective. And I thank you for listening, and our apologies for starting this briefing late. The exigencies of governance these days has made it impossible for us to continue to brief you on a daily basis and also be able to do it timely. However, I thank you for your kind attention and have a very pleasant evening. Thank you.
Chairman of PTF, Honorable Ministers, Permanent Secretaries, National Coordinator, ladies and gentlemen. From the health sector, we are seeing a gradual increase in the number of confirmed COVID-19 cases in the past few days, which we have frequently alluded to in recent times, which rightly suggests that we may well be at the verge of that second wave of this pandemic. Last week, we recorded 1,843 cases as against 1,235 2 weeks before and 1,126 the week before that. And in the past 24 hours, we have had 474 confirmed cases and 2 fatalities, with an indication that this week's figures will be higher than last week's. So as of today, we have already crossed the 70,000 mark with patients with 70,669 confirmed cases, of which 65,242 were treated and discharged. Sadly, the number of fatalities has now reached 1,184 from 1,167 2 weeks before. Now, every one of us has a role to play in the effort to prevent an explosive spread of this infection in Nigeria. While we strive for the best, we must prepare for the possible second wave, which we must ensure does not get to be worse than what we have seen so far, judging from what we observe in other countries. Certain countries in the Americas and Europe are going through a very difficult time, and we must also express sympathy with them and condole with them on their losses. But to prepare ourselves, I have directed that all isolation and treatment centers which were hitherto closed due to reduced patient load should be prepared for reopening, and that the staff complement should be put on alert. The increase in infections stems certainly from rising community transmission, to a large extent also due to the increasing laissez-faire attitude of the population, but perhaps also to a lesser extent from travelers who are coming to our country, of whom we have recorded 87 positive cases as against 59 the previous week. This number is small compared to the total number, but can increase as the volume of travelers rises, especially as people return home for Christmas and New Year holidays. To ensure that we further contain imported cases, port health officers at points of entry have been directed to be vigilant and diligent in screening travelers arriving the country, especially from high-burden countries. I did oversee the handover of the Infectious Disease Center at Federal Medical Center, Kefi, last Friday, which was constructed by NCDC. It is the second such center to be handed over to us, with more of them in the pipeline. And the goal is to ensure that every state in Nigeria has a standard infectious disease treatment center. We shall, of course, continue to engage the states constructively for better coordination and outcomes in our fight against COVID-19. The Federal Ministry of Health organized a media engagement on the 7th of December with participation of Federal Ministry of Health departments and agencies, and joined by stakeholders, partners and donors, civil society, and well-wishers to examine our health system and inform on its organizations and functions. The ministry unveiled plans and aspirations guided by President Buhari's 9-point medium-term health sector next level agenda of 2019 to ramp up the push towards universal health coverage. A key event of the media engagement was a public presentation of the fully revised guideline for administration, disbursement, and monitoring of the Basic Healthcare Provision Fund, approved by the National Council on Health, and which has been operational since last several months. It resets the implementation process to align with the National Health Act. The first set of candidate vaccines are ready to be rolled out in Europe and the USA. a Nigerian technical team led by the National Primary Healthcare Development Agency is working on evaluating prospective vaccines and Nigeria's vaccine needs, as well as the possible cost implications. We are working with the WHO and Gavi-led COVAX facility and other stakeholders to ensure that Nigeria will have access to quality vaccines when they are deployed. We also continue to explore all avenues of getting access to additional vaccines should we need more. And in that connection, we met with His Excellency, the Ambassador of the United Arab Emirates to Nigeria at the Ministry of Health to discuss cooperation in access to vaccine technology and production, which his country has already signed up with China for Chinese vaccines. He reaffirmed his support for our country in our response to the pandemic. Federal Ministry of Health and Katsina State Government signed a memorandum of understanding to upgrade the Federal Medical Center Katsina to a teaching hospital for the Medical School of Umaru Yar'Adua University, Katsina, a testimony to the commitment of this administration to develop human capital for health and move the health sector to the next level. A similar arrangement is pending for Otrokbo in Benue State. Until vaccines are available, our best bet is still the appropriate use of face masks, physical distancing, sanitizers, and observance of respiratory hygiene for prevention and control. We must, as has just been advised by the SGF, we must avoid unnecessary travels. We must avoid crowded places. We must avoid gatherings where there's uncontrolled interaction of people. And again, I will emphasize what the SGF said. Removing your mask to talk to someone defeats the purpose of the mask. So, even if you are not wearing a mask and you want to talk to someone, that's when you should put on the mask. So those who put it on and they take it off to talk to someone are totally defeating the purpose and doing exactly the opposite of what should be done. So I would like to emphasize his words that you keep your mask on, not only to cover the mouth, but also the nose, because if you do remember, for those who have done a test, one sample is taken from your throat, another sample is taken from your nose, because this virus can come as well out of your mouth as out of your nose when you exhale or when you breathe out through the mouth or when you speak. So in that connection, it is not too early to strongly advise now against throwing caution to the wind during this upcoming Christmas and New Year holiday. We must not forget that COVID-19 will not take holiday. It will not join, it will not take a pause during Christmas or during the New Year celebration. So I want to urge all of us not to think that everything is in order and it can go ahead. Prayers will help us, but only if we first help ourselves. And I want to ask that we endeavor to protect ourselves and protect each other, and to still obey the measures of non-pharmaceutical intervention, even during the festive periods. Thank you for your attention.
I think our chair and the Honorable Minister have done justice to really the big topic of the day, the increasing number of cases that we're seeing across the country. And good thing our surveillance system has picked them up, demonstrate the system is working, And now really it's for all of us to respond to that increase collectively. So the numbers have been announced by our chair. Critically, the states with the highest increase in the number of cases, FCT, Lagos and Kaduna, and you would have seen various announcements by the leadership of all those states in terms of what they intend to do over the next few weeks. We also want to put a little bit of emphasis on states that are still not testing enough, especially recently, Cross River, Jigawa, Kogi, Osun, Ebonyi, Adamawa, and Zamfara states. It's very important. You can't manage what you don't measure. The only way we can manage this outbreak, plan for the response, plan for vaccination, is if we understand the burden of disease in Nigeria. So yes, as we focus on the states that are reporting more cases, we also need to pay a little bit of attention to states from whom we are just not getting enough tests to have any idea of what is going on in those states. So please, colleagues, we need to work together on that. A few short other points. As we get into the end of the year, we must remember, like both the Honorable Minister and the Secretary to the Government of the Federation have emphasized today, that the tendency is that we will be drawn into social gatherings. It's the norm at this time of the year that we are planning all our festivities, planning to come together. Please, we just have to hold this down a little bit longer. So it's not just about individual responsibility, because individuals decide on whether to go to events, but somebody organizes those events. So whether you're the leader of a family, a church, a mosque, whatever social cultural event being planned, please always consider, if you absolutely have to do it, how are you going to implement it within the norms of what is necessary right now? If you have family coming in from abroad, please remember that they take the test before they leave and take the test on arrival, and actually spend the 7 days in isolation if they really have to come back home. We have to hold them accountable to this. So collectively, we must advise them to please stay indoors after arrival, and on the 7th day do their test, so they keep the rest of us safe if they have to come back to Nigeria at this time. Over the next few weeks, we will be sustaining the response. The labs across the country will keep working. The EOCs will keep working. We have rapid response teams on standby to deploy if necessary. So Nigerians can rest assured that as we slow down towards the end of the year, the response activities will keep working to keep the country safe. The second stream of NYSC is now in full swing. Testing has happened for all those getting into that second stream, and the third stream will happen early in January. We're also working, preparing for every other event, so like the National Sports Festival that we'll hold at some point early next year. These are well-controlled events. We're planning with them. Our biggest source of worry is actually the small, uncontrolled events happening all over the country where nobody knows who is doing it, who is planning, who is managing, what are we doing, especially when these things hold indoors. That's where they really present the biggest risk for our country. So just to conclude, as we go towards the end of the year, just all of us to just remember to hold ourselves accountable to doing these very difficult measures, especially indoors, especially when we think we've let our guards down. Over the last few days, those of us in this response in Abuja have had many, many, many personal experiences of people that have come down. We don't want to get back to the situation we were early in the year. But right now, the numbers are not looking good. We need to take it very seriously as we plan to end the year. Thank you very much.
So I just have a few things that I wanted to mention. First of all is the issue of travel during the holiday season. This has been echoed over and over again by both the Chair, the Honorable Minister of Health, and DG NCDC. There's no doubt as we approach the festive season, there's a high risk of contracting the virus due to mass travel. The PTF is urging everyone to avoid international travel this season unless it's for an essential need. There's no doubt travel restrictions will continue to grow across the globe due to rising COVID-19 cases. There are countries in Europe that have seen a tripling in the number of new infections per day in the last 24 hours. So there's no doubt, even in Nigeria, we are monitoring the situation very closely. We are monitoring the rate of infections we are having, and there's still a possibility that you could potentially get stranded if you come in country. So unless your travel is really essential, please stay at home and celebrate Christmas at home. COVID-19 is still a significant threat, and our attitude and behavior this holiday season will determine how we will live into 2021. In terms of the issue of the testing, as DG NCDC said, if you're coming in country, you need to come in with a negative COVID-19 PCR result. This needs to have a validity of no more than 5 days. You also need to self-isolate for 7 days and do a repeat test at day 7, PCR test. The travel portal is now working very well. I've used it numerous times for colleagues and friends, and it has worked very well. If you do not want to have undue delay at the airport, it's better you use the portal, pay for the test before you arrive. It's much, much faster. Within minutes, you will clear Port Health. If you don't, you may be subjected to long delays while you sort out the travel portal. We have moved to a paperless system, and we are no longer accepting health questionnaires that are filled physically or manually, or COVID-19 results that are physical. We expect everybody to use the portal when you are coming in country. Fill the health questionnaire, upload your COVID PCR result, and pay for your test. Now, travel-related tests for COVID-19 are not free. For any other reason in country, PCR tests are free. If you have symptoms of COVID-19, you are not expected to pay for the test. If you've had contact with somebody who's had COVID-19, you are not expected to pay for the test. If you are worried about COVID-19, we don't expect you to pay for the test. But if you are traveling, whether it's for personal or official reasons, you have to pay. However, not all travel, not all exit travel out of Nigeria requires tests. And let me make this very clear. Majority of countries do not require a COVID-19 test. So it's your responsibility as a passenger to check with your airline and also to check with the country's embassies where you're going to, whether or not you need a PCR test. For the majority of countries, you don't require a test, so do not waste your time getting a COVID PCR result, unless it is necessary if you are exiting the country. However, if you are coming in Nigeria, you need a test. It is not the policy of the PTF or the federal government for people exiting the country to require a mandatory COVID PCR result. It's the responsibility of you to check. There are numerous countries that don't need it. So do not waste your money paying for a COVID PCR test that is not required. In January, we are working very closely with NCDC, and we hope in January we will have a new system for testing at day 7, which will significantly drop the cost of the current tests to hopefully down to at least 80% of the current cost, in which case it should be affordable to everybody, and there will be no reason why people should avoid testing. At the moment, 40% of those who present for testing, 40% of those who pay do not present for testing, despite being contacted by the private laboratories and reminded of testing at day 7. The issue of fake PCR test results has been raised already by the Honorable Minister of Health. These sort of practices are illegal, they are abhorrent, and they endanger lives. they also spoil the reputation of our country and will not be tolerated. I'm pleased that the Honorable Minister of Health has already set up an administrative panel to investigate this, and all those involved where found culpable will be dealt with fully according to the law. We will not tolerate a situation where persons are putting at risk other citizens. We are working closely with the private laboratories to have a technological means of identifying and verifying genuine results. The airlines will be directed to use this method on all laboratory results for people exiting the country. And where you are found to have purchased a fake result deliberately for the purpose of traveling, then you will be held liable as well. But we will be putting this in place over the next few days. In terms of the issue of the cases rising in the country, there's been a lot of debate about why, and I don't think it's complicated. The reasons are very clear. Generally, the public are not using non-pharmaceutical interventions. The use of face mask compliance is extremely low. There's a lot of crowding. People are engaged in close contact with each other in enclosed environments. And the feeling is that COVID has gone away. Sadly, COVID is still very much with us. And if anything, we are seeing what is potentially a second wave. We've seen this with the numbers that have been coming up in the last few days. The increase in testing will not explain this. 25% increase in testing over the last 1 week, 92% increase in cases. So it's very clear that the number of cases is dramatically going up. Our treatment centers are always also filling up. We had very few patients in November in our treatment centers, and that's now increasing, and we're seeing more and more people going on to intensive care, and we've had several deaths in the last 1 week. So our plea to the public is, do not let your guard down. Do not follow the crowd. If you catch COVID, it may be a personal tragedy for you and your family. So it's in our best interest to avoid mass gatherings, to avoid close contact, to avoid those that are not wearing masks that are coming close to us because they are a danger to us. And for government institutions, public buildings, public institutions, we expect that the use of face masks will be enforced. We've already asked the head of service to communicate this to the different heads of government and the permanent secretaries, but this also applies to commercial premises, and we will be holding the owners of these commercial premises responsible if there is a clear breach of the enforcement of face mask use. Face masks are still mandatory in public places. They're still mandatory. You have to use a face mask in order to protect yourself, but more importantly, to protect others. For vaccines, I'm pleased to inform you that there's been a dedicated session today on vaccines at the PTF. Had a presentation from the Executive Director of the Primary Healthcare Development Agency. We've discussed in great detail how the possible funding could come through, and he will be giving you a brief in the next few minutes. Finally, I just wanted to say that the PTF remains very much appreciative of the immense support we continue to have from different organizations, governments, individuals, and citizens in the fight against this pandemic. We continue to encourage everyone to continue the fight to slow this spread. This is clearly a delicate period for the response. We may potentially be heading into an epidemic crisis, but there's still time to reverse this trend. Please, let's wear our face masks. let's maintain our physical distance, let's wash our hands, and let's protect our loved ones that remain very vulnerable to COVID-19 infection. Thank you.
Thank you very much. And the chairman of PTF talked about it, and that the country is following closely events around the world. And the national coordinator just mentioned that today, in our briefing, we have the Executive Secretary, National Primary Health Care Development Agency, Dr. Faisal Shuaib, with us. We will now invite Dr. Shuaib to please get to the restroom to brief us on vaccine. Thank you, sir.
The Chairman, Presidential Task Force, and Secretary to the Government of the Federation, honorable ministers, ambassadors, colleagues, gentlemen of the press, distinguished ladies and gentlemen. Today, I'll be providing an update on our preparedness for COVID-19 vaccination in Nigeria. At the outset of the COVID-19 pandemic, the global community, led by the World Health Organization, Gavi, the Alliance for Vaccines and Immunizations, the Coalition for Epidemic Preparedness Innovations, established the COVID-19 Facility, or COVAX for short. COVAX is one of the 3 pillars of the Access to COVID-19 Tools Accelerator. The COVAX Advanced Market Commitment is an innovative financing instrument focused on ensuring fair and equitable access to COVID-19 vaccines for low and middle-income countries like Nigeria. This makes otherwise very expensive vaccines affordable because of the collective multilateral negotiations with pharmaceutical companies. Nigeria is one of the 92 economies that form an integral part of the COVAX facility project. So we are on course to access safe and efficacious COVID-19 vaccines in the first quarter of 2021. However, this space is highly dynamic, but the Presidential Task Force and the Federal Ministry of Health is actively engaged in discussions around getting these vaccines to Nigeria as soon as feasible. We will be leveraging on the polio resources and experiences to ensure successful delivery of the COVID-19 vaccines to the last mile, especially to the high-risk populations. The high-risk populations are defined as the frontline health workers, their support staff, the elderly, and those with significant comorbidities such as diabetes, hypertension, cancer, lung disease, etc. We have established a supra-ministerial advisory committee for COVID-19 vaccine introduction, which will be fed by a multi-sectoral technical working group made up of the Federal Ministry of Health, the National Primary Healthcare Development Agency, the Nigeria Centers for Disease Control, NAFDAC, the Federal Ministry of Finance, Budget and National Planning, the Federal Ministry of Information, National Orientation Agency, the Nigeria Television Authority, civil society organizations, professional bodies, the media, and organized private sector. Other members include our beloved partners and donors. The technical working group currently meets every Wednesday and has already come up with a comprehensive rollout plan that includes risk communication in collaboration with traditional and religious leaders, as well as community-based organizations. In wrapping up, I want to emphasize that the Presidential Task Force, the Federal Ministry of Health, and NAFDAC are involved in many COVID-19 vaccine discussions, focusing on vaccine safety and efficacy. The confidence reposed on us to deliver safe vaccines to Nigerians is a sacred trust. It is a trust that we hold and cherish with the highest degree of responsibility. So when we eventually roll out any COVID-19 vaccines in Nigeria, we want to assure you they will be efficacious and they will be safe. Thank you very much, and God bless.
Thank you very much. The
PTF and Secretary to the Government of the Federation, honorable ministers, member of the Presidential Task Force, ladies and gentlemen of the press, good evening. Just a few points to complement the update we've got so far this evening regarding the general trend in the world on COVID-19. Over the last 3 days, global cases crossed the 69 million mark, now at 69,215,613 cases. The USA crossed the 15.5 million mark. The WHO African region remains slightly above 1.5 million cases. The global case fatality rate remained at 2.3%, and the WHO African region case fatality rate remained at 2.2%. The USA continues to record high daily case incidence of over 226,700 cases daily. Brazil's cumulative test positivity rate remains the highest among the affected countries at 26.2%. On the WHO African region, Nigeria ranked 5th for the highest cumulative cases and 3rd in the highest cumulative deaths. In the previous 24 hours, as of yesterday, a total of 650,511 cases were reported from 170 countries and territories, the highest proportion being from the America, largely the USA and Brazil. As I said before, cumulatively, we have reached 69,215,613 cases that have been recorded from 220 countries and territories and 2 international conventions. The top 5 countries in new cases reported in the previous 24 hours include the USA, Brazil, and Turkey that has jumped to the 3rd position, followed by India and Russia. These 5 countries account for 56% of all new cases reported globally. 5 countries, the US, India, Brazil, Russia, and France, have the highest number of cumulative cases, accounting for 54% of all cases reported globally. 3 countries, the USA, India, and Brazil, account for 47% of cases altogether. In terms of global deaths, there were 12,351 deaths reported from 117 countries and territories worldwide, with the USA accounting for 26% of all deaths, and cumulatively, we've passed 1,574,892 COVID-related deaths. And the global case fatality rate, as I said before, it's at 2.3. The situation in the WHO African region, there were 13,126 cases reported from 34 countries in the previous 24 hours, leading to a cumulative number of 1,586,520 cases, including 35,236 deaths. South Africa and Ethiopia continue to report the highest case count in the region. South Africa remains the country with the highest cumulative cases count. It continued to register a steady decline in cases, though. So cumulatively, South Africa accounts for 52% of cases reported on the African continent. There are a number of countries that are driving what appear to be a second wave in Africa. These are South Africa, Uganda, Algeria, Ethiopia, and Kenya. They all account for about 78% of all new cases reported in the previous 24 hours. Cumulatively, the top 5 countries are South Africa, Ethiopia, Algeria, Kenya, and Nigeria, which account for 75% of all cases. It's important to note that the trend we are seeing now in Nigeria is being seen in Africa around us. So it may point for some new development in the course of the epidemic, hence the need for us all to remain vigilant. Do postpone unnecessary travel. Continue to wear masks in public. Avoid amplifying events and large crowds. Observe other non-pharmaceutical interventions. Using hand sanitizers. Washing our hands frequently. Do not remove masks to speak. Let's be cautious, because the phase we are in now can escalate. If we look at the curve, where we are now, it's where we were around February, March in Nigeria. We need to avoid another wave in Nigeria and work together to ensure that we continue to observe these measures as we prepare for vaccine. Vaccine alone will not solve the issue. We'll still need to continue with non-pharmaceutical intervention for some time. We will need that combination of intervention. It's very important that we all adhere to these measures. Thank you.
My name is Nancy Oyedia Orum from AIT. I would like to start with
The vaccines, as you know, are just coming into the forefront. Before now, we have been looking very closely at what is happening with the trials, phase 3 trials, the certification, and all the other activities that lead to the beginning of the use of the vaccine, all the various tests. As you know, this process of developing a vaccine for COVID-19 has been severely accelerated. It has been done very quickly. And most of the companies who are producing this vaccine want to be indemnified. That is to say, you don't hold them responsible for whatever happens in the vaccine with the use of the vaccine. They want to be indemnified. That's the first thing. And which means you use the vaccine at your own risk. Nevertheless, we look at how it is being applied in their countries, various countries where they have started. They started, as you know, in the UK already a couple of days ago. And the US is just waiting for the FDA to give them the go-ahead to start. Many of these countries have said that they want to vaccinate their own citizens first. Now, when we do get ours, the first port of call will be NAFDAC, which is responsible for giving certification to all drugs and medicines and even food and cosmetics that are coming to this country. That will be the first port of call, and they will be the first to give the clearance, the bill of health for anybody to use those vaccines. As for the reactions, the UK reported the reaction of 2 persons to the vaccine, which were not, up till now, were not further, didn't get any worse. But the observation, all eyes are on those who are receiving these vaccines to see the effect, what will happen. And in fact, the US has been giving advisories to all the citizens who will receive the vaccine, who have not yet received it, on what to do and what reactions to expect. So the question of reaction is being very closely monitored. People are watching out for the reactions and, of course, later on for the efficacy. As for the cost implication, you must look at 3 main areas. First of all, the cost of acquiring the vaccine. How much does this vaccine cost? There are 2 types of vaccines right now. The mRNA vaccine, as you know, which is produced by one American company and one American/German company, and then a good group of viral vector vaccines, which use the conventional method of producing vaccines. There are, I think, about 4 or 5 already mentioned, but there are a good number more doing their clinical trial waiting to join the queue. Now, one of the vaccines has to be stored at minus 75 degrees centigrade, ultra deep freezers. So anybody who buys that, we have to buy the fridge along with it. So if you didn't buy the freezer, you can't store those vaccines. The second one that also comes from the US requires freezers of minus 20. So that was a little bit less. I think we have more of those refrigerators in Nigeria here. But in minus 75, we have only a few which are used. I think NCDC has some, but they use them for other purposes, but not for storage of vaccines. So if you want to buy that type, you must reckon the cost of the vaccine, or the cost of the storage, and the cost of keeping them, and then the other vaccines which we are told can be stored at 2 degrees. That is to say, in a regular fridge. So if you want to look at the cost, you don't only look at the cost of buying the vaccine or the cost of getting it here, but the cost of keeping it. And then finally, the operational cost, that's the cost you pay for actually going to give people the vaccine. You need syringes, you need a trained health worker, they all must all be paid. So the cost implication goes across those lines, plus a few other costs that we have not yet mentioned, but those also are minor costs. And for us, we are looking for what is most favorable. Now, we have we're a population of 200 million. Well, there is a hope of vaccinating as many people as possible, but we want to start with at least 20 million doses, which we are expecting from the COVAX facility to cover mostly those who are, beginning with those who are working in the health sector, who are exposed to risk, who are highly exposed, and then to vulnerable and people who are more at risk. But that whole strategy is still being developed from our own side here. So I think I leave the question on the PHC to the Executive Director of PHC to come and answer the specific question in the Primary Healthcare Center, Dr. Shuaibu.
Thank you, Honorable Minister. I do not think that there was a specific question on the PHC, just recognized the work that we're doing in PHC. I think the Honorable Minister has pretty much covered all the questions except for one, which was around the number of doses. Right now, for most of the vaccines, we're looking at 2 doses, right? There are a number that are looking at 1 dose, but those are still candidate vaccines. But for those that have at least received approval in the United States and the UK, emergency use authorization, there are 2 doses. So the Pfizer, BioNTech, and the Moderna vaccines are 2 doses. I think those are the questions that the Honorable Minister. Right, so in terms of the budgetary provisions. This is one of the issues that we concluded with the chairman of the Presidential Task Force around how some additional funding can be provided in the 2021 budget. The 2021 budget has not left the National Assembly and has not been assented to by Mr. President. So there's always that opportunity to advance a compelling case for why we should have funding in the 2021 budget for COVID-19 vaccines. You will recall that, there's been so much in terms of the rapidity with which COVID-19 happened. So we have been just learning on the job, trying to take decisions around what to prioritize in terms of our resources. And we're at the point, just like the chairman mentioned, where vaccines are now a priority. And I'm sure that we'll find it within our basket to make the necessary decisions and provisions for vaccines that will protect all Nigerians. Thank you very much.
It's just that what we discussed is that it's good to set aside, to speak with the National Assembly to set aside a certain amount. Not that we know exactly what is going to cost, but to have something to start with when the need comes. We do not have a real budget as yet, because nobody can really measure the volume or the extent of expenditure, but just to have something that you can put your hand into, even if it's for a down payment.
So thank you. Three quick questions. I'll start with the last one. Mitare asked about the 5 cases in Kogi. It's unlikely to represent the picture of cases in Kogi. That's straightforward. I think we all realize that, and we've said that severally. You also asked about contact tracing. Contact tracing happens every single day. So there's no need to keep emphasizing the same thing. Every single new case is followed up, contacts are followed up, they're all tested, and then we find more cases. That's bread and butter of what we do. So that continues across the country. And the first question on an individual who was said to have come back to the country, we can neither confirm nor deny if we had tested the person. We never comment on individual cases, especially not to members of the press. So thank you very much.
So I believe I have 2 questions. The first one has to do with the National Testing Week. Preparations are still ongoing. We had a meeting with all the state commissioners of health, and last week I also presented to the Nigeria Governors Forum, the state executives. Most of the funding is going to come from the state governments, so this is why we are having some delay. It's going to come from part of the funds that have gone to the state government, so we have to negotiate and make sure that these funds are released on time. The plan is to test a minimum of 450 to 500 persons over a 2-week period using primary healthcare facilities mainly in all the local governments in the country. However, there will be states that would require more than 450, 500 tests, because we are aiming towards filling the gap that currently exists in terms of the target 1% of the population required to be tested. We're really looking at early January after the new year, and the NCDC at the moment is closely involved, but they are also engaged in preparations for the NYSC camps, as well as the National Sports Festival preparations, etc. So they already have a lot on their plate, and that's why we've had to hold back a little bit, together with the need for the financing to come through the states. But we will update you as soon as we have further information. In terms of the question about capacity to manage the second wave, the Honorable Minister of Health has already instructed the treatment centers under the Federal Ministry of Health to reopen. And we're also asking state governors to please reopen your treatment centers. We are seeing a lot of cases going into the treatment centers, and we are already seeing very severe cases requiring ventilation. There's no doubt we're back to August figures. Looking at the figure we had over the last few days, the numbers have been quite significant. You do not need to be a mathematician to know that the numbers are going up. But having said this, we still have an opportunity to reverse this trend. The virus is spreading. It's spreading from person to person. If all of us consistently wear face masks, if all of us consistently keep our physical distance, wash our hands, and are very sensitive to our environment and to those who are not abiding by these rules that are posing a risk, a danger to ourselves, we can interrupt this transmission. Back in March, April, if all of us had followed the NPI protocols, this epidemic would have been over within 6 weeks. But here we are in December, in the midst of a possible second wave. But we can still stop it. It's not too late yet. Let's protect ourselves, and let's please make sure that we follow the non-pharmaceutical interventions. They may be inconvenient to most of us, but they are potentially life-saving. And there's a limit to how much capacity you have from the health system in terms of managing an outbreak. Outbreaks can easily overwhelm a health system. If you have persons on ventilators and you require a ventilator and all the ventilators are taken, what happens? Nobody will be switched off a ventilator because you need one. So protect yourselves, keep safe. Thank you.
Validation of approval of vaccine. As I mentioned already before, WHO will only validate a vaccine that is truly efficacious and safe. We are aware that some national regulatory agencies have approved emergency use of some vaccines in the UK, also in the US, and others may follow. But I want to emphasize that for WHO to validate a vaccine for emergency use, there is a process. There is a strategic advisory group of experts on vaccine immunization, which advise the Director General on validation process. We are in touch with this vaccine developer, the manufacturers, and the WHO requests access to detailed data on efficacy and safety. And we continue to encourage the vaccine manufacturer to continue to monitor trial patients, particularly to know also the duration of the protection. But overall, there are more than 210 candidate vaccines being tested, a different phase of vaccine development, of which about 48 are already in clinical trials, 10 are very advanced, and those that you are seeing on the news are part of the 10 that are well advanced. We can anticipate that there will be more in the next few months or so that will be added to the pipeline. But the bottom line, we need to make sure they are safe and they are efficacious before approving them for emergency use or including them on emergency use list. Thank you.
Members of PTF, Your Excellency, the Ambassador to South Korea, ladies and gentlemen, I was asked 3 questions. First is on the issue of bailout to the airlines. The issue bailout is a policy matter being handled by the Federal Ministry of Aviation under the direction of the Home Minister of Aviation. What I can say on the bailout, the $5 billion bailout is to the airlines and to other service providers within the industry. I know a committee was set up to work out the modalities to ensure this bailout is shared accordingly to all those who are entitled to it. And I know the committee has finished or about finishing, and shortly we should be hearing from the Honorable Minister of Aviation on the issue of the bailout. As regards tickets prices, yes, ticket prices have gone up astronomically over the last week or so. That is one of the consequences of the COVID-19 pandemic. The aviation industry, aviation and tourism travel industry is one of the most devastated industries by COVID-19. You know, we had a shutdown for several months. The airlines were not making money, and they have fixed costs they have to deal with. They have to maintain their aircrafts. And unfortunately, most of these aircrafts are maintained outside Nigeria. Two issues with that. Because of the shutdown, they don't even have slots to take their aircrafts out. And the dollar rate has gone up. They need to raise enough money. So the problem basically is that of supply and demand. The supply for airline seats has significantly gone down, while the demand domestically since we open is going up. So it's simple economics 101, where demand exceeds supply, the prices go up. Then the issue of 300 SAC staff. Yes, there was an issue, but the staff were never sacked. There was a labor dispute between one of the airlines and the staff on some disengagement and entitlements. That was a threat, but however, the NCA, we intervened. We spoke with both the management and the labor unions. They agreed to go back to the discussion table. And the last report I received, they've made significant progress in closing that gap. So we hope they conclude and nobody's sacked. Thank you.
Honorable Secretary of the Government of Federation and Honorable Minister of Health and Science, and I know the NCDC, distinguished guests and ladies and gentlemen. On behalf of the Korean government, it is the great pleasure to attend this great ceremony of the COVID-19 PCR test kit to the government of Nigeria. I would also like to use this opportunity to commend the Nigerian government for its hard effort and great success in the fight against COVID-19. In this challenging time, I wish to reaffirm Korea's solidarity with the people of Nigeria. Korea will continue to support Nigeria so that together we can win this war against COVID-19. Ladies and gentlemen, this year marked the 40th anniversary of the establishment of the diplomatic relation between my country and great Nigeria. We have been friends for a long time, and I am confident to say that during my service as ambassador, our relationship has become rock solid like true love. When the pandemic first hit Nigeria and you reached out to the world to seek help, Korea was there to hold your hand. The Korean government supported your effort to battle the disease by providing Korean facial masks and PPEs. Both of the federal and the state government, we also provided the palliative for local community. Many Korean companies also joined our effort to help Nigeria. Today is the backside. The Korean Samsung Heavy Industry donated 5,000 PCR test kits to the federal government at the outbreak of the COVID-19. Hyundai Motors donated PPEs. They are worth 35 million naira to the government of the Lagos state. And now, I'm so proud to deliver another 30,000 PCR test kits to Nigeria. They say, a friend in need is a friend indeed. So we are here for our true friend. Actually, Nigeria are like my brother and sister. So we are close than a friend. Lastly, I wanted to wish everyone here and the people of Nigeria safety and good health. On December 8th, first COVID-19 vaccination took place in UK. Hopefully, the people around the world, including Nigerians, will soon be able to receive vaccination so that we can be free from COVID-19. Let's pray that soon we'll be able to smile and meet without the face mask like the good old days. Until then, we shall join our hands and overcome this pandemic together. Thank you, and God bless you, and God bless Nigeria.
Strategy. We have an important pillar in PTF that have been working hard to ensure that our messages were able to get down to the grassroots. They work hard. This book will be unveiled now by the Honorable Minister of Information and Culture, Alhaji Lai Mohammed, who will now do the presentation. Honorable Minister, please.
The chairman of the PTF COVID-19 and the secretary of the Government of Federation, honorable ministers, Your Excellency, the Ambassador of Korea, distinguished members of the PTF COVID-19, gentlemen of the press. Let me welcome you all to the usual regular press briefing of the PTF once again, which today will also feature the public presentation of the risk communication and community engagement strategy document on COVID-19 to the public. Since the advent of the coronavirus in Nigeria in February 2020, one of the main things that the Nigerian government embarked upon and sustained is public sensitization on the novel coronavirus, its behaviors, mode of transmission, and preventive measures. Even before the inauguration of the Presidential Task Force on COVID-19, the Federal Ministry of Information and Culture and its agencies have created various programs and devoted airtime on their respective platforms to enlighten and educate Nigerians on the coronavirus pandemic. With the inauguration of the PTF by Mr. President, risk communications became one of the integral components of the national response through the risk communication and community engagement pillar, being led by the Federal Ministry of Information and Culture. Risk communication is a real-time exchange of information, advice, and opinions between experts or officials and people who face a threat to their survival, health, or economic or social well-being as a result of the disease. The main aim of risk communication is for people to be able to make informed decisions to mitigate the effects of the threat, such as a disease outbreak, and take protective and preventive measures. Information sharing is carried out on a multimedia platform: radio, television, newspapers, social media, and community engagement, working with influencers such as religious and traditional rulers, opinion molders, groups, associations, etc. In response to the COVID-19 pandemic in particular, the Federal Ministry of Information and Culture was able to mobilize the entire broadcast sector under the umbrella of the Broadcasting Organization of Nigeria and supported them with tax relief and debt forgiveness to enable them to devote a chunk of the airtime to public sensitization on COVID-19. The ministry also reached out to the Newspapers Proprietors Association of Nigeria, online publishers, social media influencers, and other critical stakeholders in the media to ensure that COVID-19 preventive measures remain on the front burner of public discourse. At the moment, the ministry, with support of the PTF, is broadcasting messages on the various thematic areas of prevention of COVID-19 on 10 television stations and 50 radio stations across the country in different languages. The ministry has also set up live discussion programs on some radio stations in Kano, Lagos, Abuja, and Enugu to continue to engage with the public, sustain the discussion around COVID-19, and encourage the public to take responsibility and guard against contracting the virus. The ministry produced over 60 radio and television jingles on COVID-19. I'm also aware that the Federal Ministry of Health, the Nigerian Center for Disease Control, the National Orientation Agency, Nigerian Television Authority, Federal Radio Corporation of Nigeria, News Agency of Nigeria, Voice of Nigeria, private radio and television stations produce various jingles in their hundreds to ensure that we dominate the airwaves with COVID-19 preventive messages. With the support of the National Primary Healthcare Development Agency, the ministry succeeded in convening a meeting with the Northern Traditional Leaders Council under the chairmanship of the Sultan of Sokoto, His Eminence Alhaji Muhammad Sa'ad Abubakar, in order to mobilize the structures of the traditional institution for community mobilization against COVID-19. A committee will soon be set up by the National Primary Healthcare Development Agency, the PTF, Federal Ministry of Information and Culture, as well as the traditional institutions, in order to engage with all the traditional rulers and religious leaders across the country to sustain and expand community mobilization against COVID-19 in Nigeria. With what we have done at the PTF and the ministry, I can safely say that Nigeria has never witnessed such a massive and large-scale public sensitization on a multimedia platform as we have seen in the course of the COVID-19 public sensitization. This was attested to by the credible polling agency, NOI, which reported in one of its surveys that 99.9% of respondents are aware of COVID-19 and its preventive measures. We are delighted with the public announcement on the discovery of vaccines against COVID-19. But before the vaccines reach us, we have to remain on high alert and be vigilant in order to ensure that we and our loved ones do not fall victims of this lethal virus. The book I'm presenting today is a guide to risk communication and community engagement by the Risk Communication and Community Engagement Pillar and the National Emergency Operations Center in the NCDC. One of the lessons we have learned from the coronavirus pandemic is to continue to upgrade not only our health infrastructure across the country, but our readiness to confront such a pandemic whenever it will occur in the future. As such, this document, even though it was produced in response to the COVID-19 outbreak can serve as a resource material and repurposed for risk communication and community engagement in the event of any national health emergency in future. Let me thank the Federal Ministry of Health, the NCDC, the World Health Organization, the PTF COVID-19 under the indefatigable leadership of its chairman, for providing the technical guidance, the moral support, and messaging priorities in line with the ever-changing case definition typical of a novel virus. My appreciation also goes to all the ministries, departments, and agencies operating the National Emergency Operations Center, Center for Communication and Social Impact, Breakthrough Action Nigeria, World Health Organization, United States Agency for International Development, United States Center for Disease Control, UNICEF, UNDP, and AFNET, among others, for their invaluable support and contribution to the production of this document. It is now my singular honor and privilege to present the risk communication and community engagement strategy document to the public. I will recommend it to be adopted by the states, local governments, non-governmental organizations, and other development partners to ensure that there is a synergy in our response to the risk communication on COVID-19 or any other pandemic in the near future. I thank you very much for listening. This is the...
Thank you very much, Honourable Minister, for that presentation. Well, we are winding down.
Ministers, members of the Presidential Task Force, Your Excellency, let me start by truly appreciating, one, your presence here today, and secondly, for the generosity of the people and government of the Republic of Korea to the people and government of the Federal Republic of Nigeria by extending this kind gesture and support towards our national response to fighting COVID-19. At this material time when stocks are running out and everybody is exhausted and tired of COVID-19 that has refused to abate in spite of all the resources that is being thrown at it, the Republic of Korea is still disposed to extending this brotherly kind gesture in donating to us today 30,000 PCR test kits. That's a lot of resources. I want to assure you that we'll continue in our response and ensure that we, in the act of balancing lives and livelihood, we do everything humanly possible to tame the surging of COVID-19 in our country. We see on the news media on a daily basis what COVID-19 is doing across the globe in terms of the way it is devastating even established countries, democracies, and economies. We believe with this kind of support, in our modest way as the Presidential Task Force that has been charged with articulating and developing the national response, we would continue to do that until we receive help through the vaccines that are being developed all over the world. But the greatest vaccine that we have in our hands now are the non-pharmaceutical interventions, the wearing of masks, the maintaining of social distancing, the application of basic hygiene by washing of hands or use of hand sanitizers, and avoiding congregating in large crowds. And if necessary, even during this period of the Yuletide season, celebration of Christmas and New Year festivities, if it is not necessary, we avoid traveling. So thank you so much. And on behalf of the President of the Federal Republic of Nigeria, President Muhammadu Buhari, do extend our deep heart gratitude to the government and the people of the Republic of Korea on this exhibition of your very generous gift this evening. And we'll continue to wish you the best in your tenure and in your tour of duty in our country, and to assure you that we will continue to nurture this relationship that has been established in the last 40 years. 4 decades is not a joke at all. Thank you so much, Mr. Ambassador, and we are truly appreciative of this gesture. Let me commend the Honorable Minister of Information too, and Culture for the public presentation of a manual that has been developed with regards to one of the pillars. We have several pillars in this national intervention or national response. And the risk communication pillar is one of the most strategic that we have in place. That is the one that deals with our perception of risk and how we engage at the communal, at the local, and at the state levels with different levels of leadership, particularly in our engagement with the traditional and religious institutions and the dissemination of information as it relates to our national response. And that delves into one of the questions that was asked by Liberty and also touched upon by my friend from the Sun newspapers, which talks about meeting with religious leaders or religious bodies. Yes, I did meet with them. And the emphasis even at that meeting is for them to continue to cascade and deepen our risk communication at the different levels of their leadership. They are the ones that live with these people in the rural areas, in the townships, and because of the authority they hold, the spiritual and traditional authority they hold over the people, they are able to communicate and kind of get the trust of the people and driving home, for now, compliance with our non-pharmaceutical interventions. So that was the basis of my meeting with them. I meet with them virtually every quarter of the year, and that emphasis was made there. And I believe that in their different levels of leadership and responsibility, they have tried as much as possible to pass that information. You had the Honorable Minister of Information and Culture referring to the engagement that he also had with them. And on the NTA particularly, I saw clips of messages that came from our leaders and our traditional and spiritual leaders. Mitare, you asked what happens now that we have ceded enforcement to the states. The federal has never taken on itself the responsibility for enforcement. We have always ceded enforcement to the states because that is their responsibility. They have jurisdiction over the states. They can call upon agencies of the federal government and deploy them in furtherance of their enforcement processes. But enforcement has always been the responsibilities of the states. We just give guidelines or design protocols with their inputs. But in terms of enforcement, you remember when we were going to open up places of worship, it was left for the states after engaging with the leaders to decide how that was going to be implemented. It has not changed. And that was why in my appeal, that during this festive period, the likelihood of congregating in large numbers by religious bodies is there. And whether you like it or not, part of what is happening in the United States today, before the Thanksgiving holiday, there were predictions that their numbers were going to spike, there will be resurgence, and the figures will be quite scary. And we are seeing it play out. The truth about it is that the US recorded over 3,000 deaths, the highest since the outbreak of this pandemic in the last 9 months, the highest at this material time. With vaccine in sight, probably at the close of business today, there will be emergency certification for the use of the vaccine. But you can see the progression of the numbers. And these are all results of congregating together, attending large meetings, attending political party rallies. That's the outcome. You don't expect anything different. And especially when you do that without taking the basic precautions of wearing of mask, keeping social distancing, and sanitizing your hands or wash your hands whenever it is necessary. The logical outcome will be an increase in numbers. We are seeing it already. When the en masse protest was going on, you remember we kept saying that that would be a recipe of aggravation of the community transmission. It's playing out. We can see our figures. 2 days ago, it was 550. Yesterday, it was 474. And let me tell you, whether you want to believe it or not, it will remain within that pattern. And if we do not do anything quickly to arrest it, it will continue to progress. So we are at a level where we have no choice but to drum it into our people that COVID-19, in spite of the fact that our economy could be in a form of recession, COVID-19 is not in any form of recession. It's surging, it's becoming more virulent, and honestly, we have to do everything to drive home this message. About 2 months ago, our numbers were very low. And I can't remember somebody very close that I knew that got infected. But within the last couple of days, I can count on my fingertips people that I know very closely that have been infected by COVID-19. So it means that we are having a serious resurgence of COVID-19. And we need to take heed. This is not the time to lower our guards. If you travel the length and breadth of Nigeria these days, in some states they have forgotten about face masks. You don't see anybody with a face mask. They congregate in their numbers as they like. The issue of social distancing is not even there. Unfortunately, even with you pressmen, when you are conducting interviews, we will have to press you back and ask you, maintain social distancing. Maintain social distancing. This thing is real. It's real. And we have to take it seriously. And you have a duty, even in the pursuit of your profession, to be very, very careful about yourselves. Because you need to protect yourselves, you need to protect your loved ones. At the end of this business now, you and I are retiring back to our various homes. We have loved ones there, we have aged parents, we have people with comorbidities. We need to do everything by act and by conduct to take this virus seriously. And I believe that if we all take personal responsibilities, the truth about it is that we will be able to abate the spread of COVID-19 and await vaccines to come with their own politics. If you are a keen follower of what is happening with regards to vaccines now, I've told you here severally, it comes with its own politics of distribution and acquisition even. A lot of the countries are saying that we are going to have vaccines for ourselves first. But the truth about it is that no country can survive the pandemic if other countries are left out of the distribution of the vaccine. So there must be an equitable and fair process of distribution so that the populations of different countries that need to have these vaccines have them in good time. But the minister has already answered whether we have ordered or we have not ordered. The fact of the matter is that we will make every effort humanly possible to ensure that we position Nigeria at the right and opportune period to acquire vaccines or to procure vaccines that will be used to vaccinate our people. And I want to thank you for your patience and also thank you for all the support that we have received from you all this while. Please stay safe and make sure that you do everything possible to cross over to 2021. If you have done anything this year, to your credit, as far as I'm concerned, you've been able to remain safe and remain alive. That's the greatest credit you can have in your account. Thank you and have a good night.
Thank you very much.
Honorable ministers here and other members of the Presidential Task Force, Your Excellency, the Korean Ambassador to Nigeria, gentlemen of the press, ladies and gentlemen, good evening. It's been a very long day today with a series of questions being fired from every corner, especially the one from our AIT reporter who overloaded the members of the PTF with very useful questions. I want to thank everybody here today, and especially the chairman of the PTF for his very wonderful speech, especially his closing remarks. He's been advised that you should do everything humanly possible to cross over to the year 2021, and of course, to go beyond that. So what that means is that we continue to observe all relevant measures to stay alive. A few words from the wise men. We have seen the danger of the increasing rate of the pandemic all over the world. So what that simply means is that it is not yet over. And the pandemic still has a long way to run. So what that simply means is that we'll continue to do all necessary measures to keep ourselves alive and to our loved ones too. So what that simply means is that you adopt some personal measures, some disciplinary measures within ourselves, cancel all non-essential travels, and of course, if the travel is so essential, you must observe the relevant measures, especially with testing, with regards to testing. Then avoid large congregation, especially the large crowds that go along with the very high season of Christmas and the New Year festivities. You also advised to ensure that all necessary non-pharmaceutical measures are observed to lower the risk of infection. Avoid removing your face mask. And of course, you've been told that the face mask is meant for the face. And the face, the essential parts of the face in this regard are the nose, the eyes, and of course the mouth. The face mask is not for the chin and is not for the jaw. And of course, you are advised not to remove your face mask when you want to speak. That negates the essence of wearing the face mask. We all have a collective role
to fight this pandemic. So you are advised to educate your loved ones, educate your friends, your brothers and sisters, your colleagues in the offices on the need to continue to observe all the essential measures in order to fight this pandemic. Some of us are ignorant of some of our actions sometimes. So if someone behind you is sitting and not wearing face mask, draw the person's attention, and then, of course, caution the person. It is our collective role to ensure that we'll continue to fight the pandemic. You've been told, too, that even the vaccine alone, even when it is available, is not the end of the problem. So what that simply means is that we'll continue to do all necessary things that we need to do, that a combination of both the vaccine and, of course, all the non-pharmaceutical measures are what is needed to ensure that we stay alive and stay strong to fight this pandemic. Without wasting so much time, I want to thank everybody here today and to advise that we'll continue to do all the basic things we need to do so as to safeguard our lives and the lives of our relations. For those of you who intend traveling, please avoid foreign travel now. And of course, if your relations are to come back, advise them on the necessary tests to run on arrival. And then you also be conscious of the countries you're traveling and their test rules. Some countries do not require tests when you go there, but we require tests when you arrive in Nigeria. So be very conscious of the rules of where you're going and where you're coming from. On that note, I want to thank everybody for listening today. And until next week, when we meet again, I say stay safe and stay alive. God bless you all. Thank you.